Hi Sonia, how are you today?
Hello Dr Ahmad, yes I'm doing brilliant.
Thank you, welcome back to the clinic. And just, how have you been since the last time I saw you?
Well, since last time and you've built my face up, I feel much more confident, I feel more vibrant. I've noticed a massive difference and my friends, family have complimented me so much and it's made me feel more confident inside. Yeah, definitely.
I'm glad to hear that, Sonia. And I know that last time we had talked about the larger works, which was the lifting and the revolumising, but one of your concerns also was a lot of the small fine lines and wrinkles.
Yes.
So what I am now going to do is, today I'm going to do some biomicroneedling. And after that, we're going to infuse in some firming peptides into the skin. We will also be putting in some deeper PCL powder into the deeper layers of skin. That works behind the scenes to stimulate the natural collagen as well. After this treatment, you'll be a bit red.
Yes.
And for the next 2 or 3 days, we'll give you special sort of care. But what you'll find is that it hydrates the skin, it will get rid of the fine lines. To start doing that fine tuning, it's like you want to start finishing. There'll be about 3 or 4 sessions of these the next 2 weeks apart. And they're very good. You've got sort of smaller lines up here and just sort of wrinkles up here. It'll help smooth that out, and that'll give a really nice finishing. So we'll get you into that just now, and then we'll see you later.
I'm just saying please, thank you so much.
We've got my patient who's had a lot of volume loss, and this is due to an illness that she's been having for a prolonged period of time. And we're going to restore some of the lost volume here by targeting the areas of the deep fat pads. This is not something that we're going to do all at once. We're going to do it in stages. We're going to bring her back in 4 weeks when she's absorbed the filler, it's accumulated its water, to see where it is, and then probably pop in some more. And the idea of this is to create a very natural effect of how we're working. So I've done my markings, and what we are going to do is just inject deep down onto the bone and just pop a little bolus in. Excellent. So there is a system known as the MD codes. So what I'm injecting is the area known as CK3. And in CK3 we have certain points where we're injecting. And because she's got a lot of volume loss, I'm focusing on where the medial fat pad would be, just to get that area up to scratch. We have got a sort of a generalised, if you see the skin laxity here, we've got generalised volume loss, so I will try and go on the bone just to put little droplets, just to give a bit more volume replacement and anchoring, but we don't want to put too much in there, otherwise, as she has a naturally high cheekbone, it will give her an abnormally prominent cheekbone. So it really is a skill of being able to look at the anatomy, look at what's required and the product that you're using. So we're just going to put some micro droplets of filler, just all the way along the bone here. And the purpose of this is just to create some cushioning at the bottom there. You will probably require some more filler, but like I said, we're not doing it on this visit. Okay, probably do it on your next one. Just going to clean the markings away, and what I will do here, Sonia, is just put a little bit of pressure on, just over on here. Now let me get pressure. I'm just going to hold that across here just now. What we're doing just now is, this patient has got what's known as platysmal bands, and we're just treating a tiny little drops of toxin here, just to relax these down. That does is the bands that they get, it softens them down and gives them a softer and smoother neck. What I also did with a bit of medial Botox around the neck area as well, small amounts of Botox into the skin surface, just to give a bit of tightening of the skin. So we've done the crow's feet on one side, we're going to do the crow's feet on the other side, and then what I'll probably do is a little bit, a wee little trick, a little dot up here for the under eye wrinkles, and then for some of the bunny lines I'll probably be injecting around here as well. We've done the forehead, we've done the glabella, we've done the crow's feet, and now we're just going to do the bunny lines. Not bad. And just clench your nose up. Oh, we've got a lot of bunny lines, haven't we? And just relax. We've injected the forehead, but what I like to do also is, when we're injecting the forehead, sometimes people get a Spock eyebrow or a raised brow, and I really like to, when I'm injecting, leave a little bit that I put in just at the side here, just to make sure they don't get a Spock eyebrow or a Spock lift. And I plan my injections in such a way that I do something called a micro Botox, micro droplet technique, which gets small amounts of toxin into the forehead. It also allows me to inject into a point which will stop Spock eyebrow, and also stops the Botox from going too deep, migrating all the way down and causing the brow to droop down. So done correctly and just with a little bit of planning, you can actually have a very beautiful result with no side effects at all. Thank you. Amazing day, guys, just an absolutely amazing day today. 3 thread lifts, we did a brow lift, mid face and lower face lift, and a neck lift. So it was quite interesting, had all the different lifts in there, the brow, the mid face, the lower face, and the jawline. A really interesting case today. Someone who's been unwell for a long period of time, has had a lot of treatment, and as a consequence has lost a lot of weight, and they lost the fat pads in the face as a result of the weight. So we did a very technical replacement of the fat pads, and the patient's just old features have all come together again. So absolutely amazing day so far, feeling on top of the world. I think I've got 4 very happy patients that I've just left this afternoon, and I think that's the doorbell for the next one. I'll catch up with you later.
You've had some lip enhancement done before, but you feel that the volume just on the lower aspect of your upper lip is slightly lower because you've got a defined border out there. In addition to that, there's a ratio of 1 to 1.6 between the upper and lower lip. So the technique that I'm going to use, the technique that I will want to use here is just one for sort of voluming and sculpting. We're happy with the definition, we're just going to go in and we're going to volumize and sculpt. What I have done is I've given my patients a dental block, so if you can just open your mouth again for me please. That's fine, and relax. And what we are doing is we're literally placing micro droplets of filler. We're not wanting to put too much in because this is just a corrective procedure.
Gets a lot of swelling straight away, so that's why I like to give a dental block first. When you put local anaesthetic on, it causes the lips to swell a bit more. And then what we're going to do is just do a bit of revolumizing equally just on the lower lip, just to maintain that ratio.
a very global diffusion. Sit up on, please. Perfect. Perfect. And just open your eye. Excellent. Relax. Okay, so what we've done is we've done an enhancement just of the volume, not the definition. Our next stage is that I've said to Sonia that when she does do the lips, because she's lost a lot of volume, we are now going to replace the volume in the mid-face here, just to improve the ratios and to lift up here like this. She's lost a lot of volume, and it will also make her lips look a bit more natural with the rest of her face. What we're doing, Sonia, now is we're just drawing the landmarks. This is not where I'm going to be injecting. This is just my landmarks, okay? Do you have a lot of volume loss? So Sonia has been unwell and lost a lot of volume on her face, so we're going to now do a lot of volume replacement into the medial fat pads and also the mid-face area, Sonia.
Yeah.
And I think we're going to swallow the filler, I think, today. Lie back first, and just relax. And this injection is done on the bone. And I like to use a coding system. It's called MD codes. We can identify the areas. This is with CT3 and the CT2 area. And there's predetermined amounts that we would inject in there, but as Sonia has got a lot of volume loss, I'm using my own judgment to decide which how much is to go in where. Just because the fat has gone from there now. Sorry, what I've done is I've injected both sides now.
Yeah.
This side, the structure is different from this side, and that's quite normal to have asymmetry. And the sort of cheek on this side is further forward and higher up. So when we're injecting in there, we have to inject different quantities on this side. We can't make it symmetrical, but we can try and create a balance. But because you've suffered a lot of volume loss just from your health, I'm now going to put in some very specific points just along there where I think the fat pads normally should be, over and above what our normal injection points are, just to see if we can restore some of those features for you again. Okay? We're not creating new features, we're just going to restore original features. Fantastic. So, Sonia, if you have a little look.
That is amazing.
So what we've done now is we've gone ahead and restored. So what we've done here is we've restored the mid-face volume up here. So if I put that in a wee second there. So we've restored the mid-face volume up here. And also because we've done the lips earlier, it's made the lips, the size and the symmetry of the lips look a lot more natural to the size of your face. This is all that we're going to do, and on our next visit, you've got hollowness in your temples up here, Sonia, and when we do that, it will help not just lift the skin to the side, but also get rid of that indentation and give you a bit of firmness here and a firmness on this side. So that's what we're going to plan in for our next visit, is just to fill these areas up here for you, and that will finish it off. I just want this swelling to settle down. I don't want to put in too much. So we're revolumizing areas of weight loss. So we've managed to do the mid-face, but really does require the temple area filled and lifted to have that effect there and that effect there. And also when Sonia is in on our next visit, we're going to start the treatment for the fine lines and the wrinkles, okay? And we're going to hydrate the skin and put in some deeper PCL injections, and what they will do is stimulate natural collagenesis. The fillers give you that instant lift, etc. And something will be working behind the scenes just to give you a far better result. Okay? And we'll see you back in 2 weeks. Excellent. Thank you.
Basically, Sonia, through the vessel of this little cream, what I'm doing is infusing those 3 million sponge spicules that I told you about, which will stay in your skin for up to 3 days. They'll remain active. And what the sort of aim of the game here is to increase your skin cells turnover from 28 days to 7 days, which is going to massively help with your skin's sort of overall rejuvenation on the surface, but also deeper down. You'll notice that you may get some peeling or sensitivity afterwards, but it does sort of resolve on its own quite quickly. Alright, so the PCL booster has been infused into your skin, Sonia, and now we're going to do a little massage with a cocktail of rejuvenating and firming ingredients here. There's lots of peptides and amino acids, vitamins, all the things that you want your skin to just drink up after this treatment.
Is there a lot of, the absorption's quite quick now, isn't it?
So we're looking at like a 3000% increase in absorption, and with the massage included as well, we're really going to ensure that the skin absorbs all of this product. Alright Sonia, so you have just had the anti-aging biomicroneedling with some of the PCL booster in there. Tell me, how are you feeling after your treatment?
I think it's amazing. The treatment has made a drastic, big difference to my face. It's took away nearly all the wrinkles, and the treatment was very therapeutic as well. It's just, I'm amazed by it, absolutely.
Amazing. We're glad you're happy, and of course we will hopefully see you in 2 weeks' time, because we want to do this every 2 weeks so that your results keep getting better and better and better. So we look forward to welcoming you back. Thank you.